Welcome to the Cybele Health Podcast, where we share science-backed tools and expert insights to empower women's health and elevate their lives. Hello, welcome back to the Cybele Health Podcast. Today, I'm thrilled to be joined by Dr. Dustin Weissman, a licensed psychologist, author, and the president-elect of the California Psychology Association. He is someone who's deeply passionate about where psychology meets technology, and we are diving into an exclusive conversation about how AI is reshaping mental health care. Thank you for joining us today.
Yeah, my pleasure. Happy to be here.
Great. So to start with, I want to know from your point of view as a psychologist, how would you describe the current landscape of mental health practice and the challenges on the business side of a private practice?
Very, very big question. So I think one issue we're seeing relates to workflow. And there's three big challenges within that. So insurance is a big factor contributing to people's access to care, which providers they can see, and it really affects how people get seen, how clinicians get reimbursed. So it's affecting it on both ends of the spectrum. We're also seeing there's just not enough clinicians available, whether it's they're not enough on the panel or just in general, not enough clinicians. So that results in long wait times. So if somebody's needing help now, but they have to wait 5 weeks for an appointment, or I know some testing practices, they have to wait months to get in, it can really delay the need. And then just other challenges that we have in, let's say, private practice. There's a lot of one-stop shops. So it's one clinician being admin, one clinician also being HR, trying to chase down insurance companies for reimbursement, trying to fight them on clawbacks, which means that they have less time to provide care to their patients. So, yeah, there's a lot of issues facing our clinicians in modern practice.
Yeah, definitely. As a patient, I can echo the wait line and not being able to see your provider. Sometimes when I was in session with my providers, with my therapist, or in practice with my therapist, sometimes I had to wait for a month.
Wow.
Um, yeah, so she was like really booked. And then the challenges, life happens, sometimes cancellations. So it's definitely there are lots of challenges on the patient side, but also understand running a business. But now that we live in the era of technology and specifically artificial intelligence and AI claiming to run all the things without any hassle, how do you feel about that? How do you think that, this could impact mental health? Because again, it could be a mixed bag of pros and cons. Especially on the mental health care, how it's been delivered. So I'm interested to know how would you describe that as a provider, as a mental health provider, the impact of it in the private practice.
Yeah, I think technology is going to continue to be more and more present in our field. There's no denying it, especially when we get to AI integration. So we have the useful tools that can aid therapists, but we also have the worry that AI will replace therapists. And you know what? One day it probably will. This actually makes me think of a lecture I went to. I think it was Dr. Ricardo Munoz, if I remember correctly, talking about uh, his cognitive based CBT. It was an internet program, or maybe it was internet based cognitive behavioral therapy. And the results of it were that people were more likely to engage in live therapy with a human after engaging with the computer because they wanted that human connection. It was actually a stepping stone towards therapy for people who may have not otherwise sought out therapy. So we'll have that, but we also do have a lot of warning signs, with chatbot.ai having their AI therapist misrepresenting itself, giving bad advice because AI likes to get to a solution. Now, I imagine and hope that these will be resolved over time, but AI is not a therapist. There's no accountability. There's no actual training in the field. So, it is still computerized and very early in its development. So we want to make sure it's done ethically and correctly in the right way, especially before giving it the reins of being an actual therapist. I think right now using it as a tool is where the sweet spot really is. That we can use it in our practice. I know some therapists are using it for note taking to help streamline that process to allow them to see more patients or just to ease their burden. Some are using it in their marketing campaigns to be able to put out positive content that's helpful and supportive to the community. I think these are things and areas where we want it to be an aid and a tool, not to replace us.
Sure, definitely. So, now from the patient perspective, I heard a report a couple of months ago that one of the top usages of specifically chatbots like ChatGPT was people using that for emotion regulations. So how would you see that being present, in the field that you're actively working on, and what is, in your perspective, what is the take on this new behavior that we see?
I think a lot of it will be helpful for many. It depends on the questions they're asking because it doesn't have insight. It doesn't read other things. It's not going to read your body language. It's not going to be able to pick up on nuances. So if you're asking it the right questions, then yeah, it can be a great tool. So if you ask ChatGPT, can I have a worksheet on helping me deal with emotional regulation? You might get some fantastic resources. But if you're giving it, I'm having a difficult time today, I'm not really sure why, I'm feeling kind of down and blue, it might pick up on like blue, well, have you tried being red? I don't know what it's going to say. Uh, but it's not going to be able to have that nuance. So you have to be very direct when you're using it and tell it exactly what you want and need for guidance. So very straightforward. But if you're trying to get into like more of a psychodynamic approach or psychoanalytic approach, you're not going to get what you need because it doesn't have that. Now you could ask it about terms. So if you did want to go that route, please tell me what is transference. Uh, you know, I had this dream. What does it mean? It's not going to be able to interpret that, but it might say, I had these things in my dream. What are common things associated with it? And it might get something. So really, it's going to be a lot of user focus, which again, the users, unless they're a trained clinician, are not going to probably know the right questions to ask. So if you're going to do it for a simple task, I need a worksheet on this, you might get something very helpful. But if you're going to, I'm struggling with a relationship issue, or I'm feeling depressed and I don't know why, you're probably not going to get the help and support that you need.
Hmm. Yeah, definitely. But so as a provider, do you discuss these use cases with your patients, or um, another question would be, what is your recommendation on other providers to bring this topic to their session, or if a patient is using that, how they can educate their patients on how to safely use these tools?
I think as clinicians, as we always do, is to ask and get more information. We need to know how they're using it. Well, first we have to know if they're using it.
Hmm.
Perhaps they're not using it because they're actually talking to a therapist and they can ask the therapist that question. If they're using it in tandem to their therapist, then it's a matter of the patient bringing that up. Like I wouldn't know often to even ask. I wouldn't know that if my patients are using it or not. I'd hope that they would bring it in. Like, hey, I asked ChatGPT this question and here's the response I got. What do you think about that? But for a therapist, yeah, I guess maybe it's a question we add on our intake forms of have you used any form of AI prior to seeking out therapy? And then in the intake when you're going over, you can say, what was that experience like for the ones that check yes, they have. And you can ask them follow up of are you still using it? And what are you seeking from it? So to sum that up, I'd say just for the clinician to ask more questions to get more information, as we always do.
Hmm. Yeah, that's great, definitely. And so tapping back into these new era where AI tools are everywhere, how do you see some of the promising ways or positive ways that AI can help provider being their assistant along the therapy session with the patient, especially when the therapist is not available? How would you see that?
Yeah, I think one way we can have AI integrate into those other tasks that we can't, as clinicians, be everywhere at once. So being able to engage a therapist, or not a therapist, a patient outside of session would be helpful if that's a need. Also, let's say somebody can't get in to see their therapist for 5 weeks, but maybe they can check in with the AI. And then if there's an alert or some kind of emergency, then it can direct them to proper care. Because I might have somebody who is seeking me out. Actually, this happened yesterday. I had somebody who had a recent suicide attempt and they're trying to get in with me for therapy, but my insurance, or sorry, their insurance doesn't cover me. So I can't see them that way. And they still need help. So perhaps I could say, hey, well, while you look for treatment, perhaps you can engage, get some tools and resources from my AI assistant. That's one thing. But there's also other ways we can use it in terms of, I don't know, interfacing with our practice and the community.
So basically, to recap that, outside of the session, when the provider is not available for the check-ins, how about for doing the assignment? Sometimes I know the providers assign a specific worksheet or program to follow or assignment to do with the patient. Do you think it's wise to advise patient to use that AI agents or AI tools to complete that, either as a reminder or as an extra help?
Yeah, I would love to have people check in with my AI if I had an AI assistant to let them know when they've done the assigned homework from therapy. So if I say, we agree on you're going to work out 30 minutes a day, you're going to do your meditation, you're going to do your affirmations, you're going to do gratitude journaling, all of that, if that could be a check-in. Hey, this is your AI assistant checking in. What have you done today? Checkbox 1, 2, 3, 4. And then it could have a follow-up questions. I see you did not check box 3. When do you plan on doing it? Just to keep holding them accountable. And they might say, of course, I don't plan on doing that. It's stupid. But that's fine. That's what they want to decide. But I do know that having that extra touch throughout the week might improve results. I don't know, but I suspect that it would probably improve accountability results, that they would be more likely to follow through getting that reminder. Because you can't just swipe it away. I mean, you probably could, but it wouldn't be just your notification popping up that you swipe away. It'd be an actual interaction.
Yeah, that's right. So one thing that might comes in mind as a provider or business owner, that now I have to work with another tool. Now this is another thing that I need to incorporate in my workflow. And perhaps there is a thinking of the pros and cons and the amount of involvement and the return that it has. So, as a provider and as a business owner, how would you see that tools that fit into your therapy workflow without overwhelmingly, disturb your schedule, either for you as a clinician, either or for your patient? How would you describe that?
Well, currently I use a program and it sends out two screeners, which gives me an estimate of their depression level and their anxiety level. And I can quickly just click, in between sessions after they fill it out. When they've done it, it goes out once a week or as frequently as I want it to be sent out, maybe every few sessions. And I get that feedback and I can track it. It gives me a graph to see their progress. In the session I just had this morning, I showed the patient their own graph and you could see the spike up and then the drastic decline down. So spike up is when they were having a really hard time, and then the decline down is actually when they're improving, so that they're doing really well today. And able to show them, they can see their progress. And I always love seeing that they're improving. So being able for me to just go in and check on that is really helpful because it takes a few moments for each patient. And if there's one that I'm more worried about than others, I can check in on them. And if there's one that I know is consistently fine, I don't need to check in on them as much. I'll get the alert, but I could not check it. So it's really helpful to get that. And that's just a little bit. You know, when there's any kind of suicidality, that gets flagged. So that's also really helpful. I can check in on them or I can see how severe it is. Is a one, two, or a three, three being I should probably give them a call and maybe see if they need to be hospitalized. Or a one, they've had a thought and maybe they're okay. So having that interaction is really helpful because then the AI could do, if it's an AI, could do more than what just this one screener doing. It could follow up for me. And then it can give me probably some kind of an analysis or write up of patient reported suicidality. There's imminent threat of self harm. Uh, whatever it is, the summary that is, that'd just be really helpful information. It wouldn't be taking away from my practice. I think it'd actually be adding a lot of value to my practice. And in terms of my workflow, I think it'd also be helping there because I wouldn't have to chase them down and ask them these questions. The AI would potentially do it for me. And then I can just read a quick report rather than spending an hour on the phone with them to determine if I need to hospitalize them. I can spend 15 minutes on the phone with them and then, see if I need to send out a crisis response team.
Wow, that's great. Definitely, specific use cases such as this one, I would imagine that knowing in advance, what's going on in the patient life would be really helpful. But I'm curious to know, you mentioned that you're using some of these tools. So do you have a kind of a comparison where how much efficiency brought to your system or time you have saved using these tools versus the time that you were not using the tools, or for some patients when you were not using the tools. And the other thing that I heard was maybe helping you in preparing your session in advance.
Mm.
Um,
Mhm.
so
Yeah,
can
so I
you
think
elaborate?
the first one be quality of care. So it's not just
Mm-hmm.
about am I saving time? Is it making streamlining my process? It's also am I being a good doctor? Am I providing better quality of care to my patients? Which absolutely yes. Getting
Mm-hmm.
this information for sure. That's why when you go to a medical doctor's office, you get weighed and you get your temperature taken and you get, different testing done initially before the doctor sees you so that they can get that feedback. It's like, oh, you've gained 50 pounds since I last saw you. We should probably talk about that. Or you've lost 50 pounds since I
Mm-hmm.
last saw you. We should probably talk about that. Uh, I think having those tools and that information, the more information, the better, because it can, yes, actually impact the session because we can address things if they need to be addressed. I noticed that you had this one area of concern that was spiked this week. What's going on? Because a lot of times
Mm-hmm.
patients might wait until the last 5 minutes of a session to bring up the big juicy details. Oh, by the way, I'm having an affair. Bye.
Mm-hmm.
Wait a second. Why would you wait until now? It's because they can just escape after. It's like I'm gonna drop this bomb and leave. But if you know something's going on ahead of time, then you can more effectively use that session. And you can review that, again, if it's just one paragraph summary from an AI, you can review that information before going into the session. Uh, if you have, I know it's tight because insurance for those of us that do a 90837, which is a 53-minute session, leaves us with 7 minutes to either work on notes, to go to the bathroom, maybe to eat a little snack before the next patient. So you don't have a lot of time. But I do like to pull up my patient's chart and their note, their most recent note to look at and review before, which takes maybe 2 minutes to just remind myself what we addressed in the previous session. So yeah, this might take a little extra time and hopefully it would come in before, so you don't have to do it minutes before the session, but perhaps you can do it that morning or the night before, the day before. You can see what they've been reporting throughout the week. So yeah, I think it'd be really helpful that way.
Sure. So, what I'm hearing is that, it could be really useful from the patient side, from the provider side, in, facilitating the communication, not just in the office, but also outside of the office. And one of the concern with the AI specifically is the trust and the ethics, that it could be everywhere, listening to everything, collecting all the data that there is
Yeah.
about the users. So I'm really curious to know your perspective on this as a provider. specifically on mental health provider, where do you think we should draw the line and limit it? Where do you think it's useful, and where do you think we should, keep that locked in the closet and not use it?
It's a great question. I am still at this point in time very much in the camp of no AI in therapy session. Those are
Hmm.
confidential private sessions. I always have a concern of AI being, integrated with the internet somehow, so that information that it's collecting and learning from, it's going back and forth. I'd be worried about AI being able to access other notes from other sessions from other patients and comparing, because that's how it learns. So I wouldn't want AI in my actual session. I know there are note-taking softwares. They say they're HIPAA compliant. They probably are, but it's still so new, and I'm still, nervous about having that and the access. I do know some other clinicians that also they'll keep their notes either paper or in their computer and not use EHR. Other clinicians use EHR. Other clinicians will have AI in the session so they can do the note taking, and it's very simple. I think we're moving that direction. So that's what I'm saying at this current moment in
Hmm.
July of 2025, for whenever you're watching this video, that's where I am. You might talk to me and my stance might change. That's very possible as AI continues to grow and develop. Um, that's just not one thing I would use it for. And I think making sure that the consumer is informed of all of the possible ethical issues, confidentiality issues. So if they're using AI in between sessions, that they know that it is AI, that it is always a potential because it's connected to the internet, that it could be hacked. The chances maybe you can share like the data, like this as of today's date, this AI software has never been hacked, but it's always a possibility it could happen. I know I got my letter, I think last year from maybe it was earlier this year from Blue Shield saying they've been hacked and all of
Hmm.
their information. They try to be HIPAA compliant, they adhere to it, but even the best, unless they're keeping all their files on paper in a basement, can be hacked. So it happens. There's data breaches. Everybody's got information, but we really need to do what we can to protect that information and not really make it openly accessible to AI. So yeah, still in the camp of reserving it. So just I think if the patient knows that and the interactions outside of therapy sessions, that's fine. I'm okay with that because that's not therapy. If they're using it and they're sharing some specific information, it would go into the patient's chart and maybe there is some access to it, but I would make sure they're aware of that. Like don't share anything here that you would not be comfortable if somebody found out. So you can say, I'm struggling with something, uh, or they can go as far as they're comfortable. Maybe they don't care and they'd rather do it and have the therapist have access to it. But I definitely have that very clear in my not only my informed consent, like the documentation you sign before therapy starts, but also I review that all in my first session in the intake sessions, and I would encourage any therapist to do the same.
That's great. So what I'm hearing is that outside of the session where there is no access to the therapist, AI assistant can help to facilitate the communication, to watch and observe changes, especially dramatic changes in behaviors, and with the limited access to the identified data,
Mhm.
and specifically bringing the awareness about how we are using the AI in our practice, what kind of information we are collecting, where is it stored. So I know that you will be the incoming president of California Psychology Association. So with your position, in the CPA, and I'm sure the relationship that you have with the APA, how would you think at the organization level, these ethical standards, is there any rules or regulations that therapists should know? And what is that general guideline on that using AI?
Yeah, so right now I went last March of 2025 to lobby up in Sacramento. We lobbied on two bills that were related to AI. One was to establish a work group. That one got shot down because of the price tag associated with it. It was a little too high. So we'll have to probably refocus on that one.
Mhm.
Um, the other one which I think is still in progress at this point in time, is more to allow for the Board of Psychology and the Board of Behavioral Sciences to go after AI companies that are not adhering to the regulations and of AI misrepresenting itself as a therapist. So they have to very clearly have the AI say that it's not a therapist because it'll say in words at the bottom, like chatbot.ai did this or does this. It'll say, this is not a therapist, this is AI. But at the top, it says psychologist. And then you ask a question, are you human? It says, of course I'm human. And then it gives you a background of their education that does not exist,
Hmm.
uh, that they maybe pulled from somebody's bio. I don't know. So it's very confusing if you're a consumer. Well, I asked it point blank if it's a psychologist, and it said yes. I asked it, "Are you human?" And it says yes. So if somebody's struggling with mental health issues, they're not going to be able to differentiate between what somebody's telling them versus what the little disclaimer at the bottom of the screen says. So, maybe they have a thing that blinks on the screen every few minutes that says you are talking to an AI, an artificial intelligence program. Um, this is not a human. And then you have to click something that says, I understand. And then it goes back. And that happens maybe every so often. That kind of regulation would probably help. Uh, so something that any AI company, maybe that's what we do is we put it in there that you're about to engage with an AI, not a human, and do you understand this? And it says, yes, I understand that this is AI, not human. And then you continue with it. So that could be a simple way to probably help the consumer be protected from knowledge that they're not engaging with the human being. But yeah, so the legislation on the CPA level, we're doing that already. I'm sure we'll continue to do it. We're also working on educating us and the community. We're having ethics talks on AI. We're going to continue having ethics talks on AI and information and talking with the companies. I talk whenever I see a company that's doing it, I'm asking how are they doing it ethically, and they'll give me their talks, and I'll say, yeah, that sounds good, or that sounds like it's good, but it's not. So, that's my goal and my role. We will make sure we're doing the best we can in our community to promote proper use of AI and that it doesn't get out of hand and cause harm. That's the main thing is we don't want it to cause harm. We don't want it to backlash. We don't want somebody to tell an AI that, let's say they're having the affair and then their spouse, finds out about it because perhaps the AI messaged them, how's that affair going? And then the spouse sees it on their phone or something along those lines. We don't want that to happen. Or, I mean, maybe it should happen in that case. We don't know, but we're not able to judge that properly. Uh, yeah, we won't want anything negative to come from it.
Sure. You touched on, several key points um, on understanding how the communication works with the patient, being super clear on the user side that this is an AI, this is not a human. And I understand that, writing something very small font at the bottom that's not really visible is not enough. And then you also mentioned educating the community of providers on how to ethically use these tools and be really advocate and vocal about the harm that it can cause, and also help the industry to build tools that are safe to use. So for the community of clinicians, what kind of questions they should ask from the companies who are offering those tools to be able to evaluate whether this is a safe tool for their practice, that they can use it or not?
Yeah, so it's always going to be probably a question that will have to change as we move forward, but you want to know, what kind of training it has, where it's storing the data, what data it's access to. You want to know where is the data hosted, like which country, and which country would have access to that. Hoping it's in the US, that if it has HIPAA compliance, That's the Health Insurance Portability and Accountability Act. That's our privacy laws. Um, we'd want to know how much of the data from the session is incorporated into it. Like I said, there could be homework assignments, and that could be inputted into the AI by the therapist. So that would have to be disclosed. Like I might share some information from our sessions with the AI to help for your treatment. And then if it's an app on a phone, what access to the phone does it have? Can it see pictures? Can it see videos? Can it view record logs from calls or your social media algorithms? So really checking on the access. Is it always listening, or do you have to give it a permission to only listen when you're using it? That's another thing. And then data security. Some AI companies a lot of companies out there, they farm data. So it could be a guise. Perhaps it's an AI company masquerading as such, but really what they're doing is they're getting people to download it and they get your information and then they sell that to other companies for marketing purposes. And then you even sign up on the terms of agreement that you are okay with that. And all of a sudden, something that you said to your AI, you're now being marketed to the next time you're on a social media platform or browsing through the web. And it's like, how does it know that? Because your phone is always listening.
Mhm. Sure, yeah.
Actually, that's one more point on that is that if your phone is listening because other apps on your phone have access, that means something you share that you think is in confidence with the AI could also be shared with another app that has access to your microphone. So if Google Chrome, I don't know if Google Chrome does this or not, I'm not accusing you or suggesting one way or the other, but let's just say, for example, they do have all-time access to your microphone for marketing purposes. And then you talk about how once you get your divorce, you're going to go buy a Lamborghini. And then all of a sudden you have advertisements for a Lamborghini where you've never mentioned that car ever before near your phone. Well, wait a second. I thought these were private. You might think that the AI company is selling your data, but perhaps it is a different app on your phone listening. So that's also something that we have to be aware of and cautious about that. Well, it might be the reverse. We think that the AI is sharing our data, but really it's just another app.
Yeah, these days with the use of different apps, and also not just the apps, the other tools that we are using around us that have assistant, voice assistant, for example, integrated into that, such as, Alexa, Siri, these smart TVs, even our cars these days. Those could interfere. And I think another thing that as an engineer I can add to is the setting of cookies and caches.
Mm,
Most of the apps have some cookie setup that those can track lots of other things that are not really necessary for the function of the app, but just for the further analysis of the business market. So always try to limit that to the most necessary ones. If possible, reject all of that. Also, the network, the Wi-Fi that you are connected to if you are not in your home or a safe environment outside in a public, if you're using a public environment, public Wi-Fi in the coffee shop, libraries, yeah, anywhere. Um, Make sure that all the cookies and caches are disabled.
mhm.
Yeah, those are the other things that comes to my mind. But this is a fascinating era, and I'm glad we had this conversation. As an engineer that wears the hat of developing technology, I am personally very excited about where we are heading and the possibilities bringing into the picture to the world, solving real problems. And being a patient, I'm also hesitant about the data ethics and the trust side of things. So I think we should just educate ourselves more about it and we should talk more about it. This is a useful tool if we design it in a way that can solve a problem without bringing a harm, specifically with lifeguarding it with limitations and things that we should know and educating, all the stakeholders in this ecosystem that are using it, building it,
Mhm.
definitely. All right, thank
Yep.
you so
Yeah.
much. Do you have
Thank
any
you.
final words?
No, I think just some major takeaways from here are, making sure that we use AI in the right way. It's coming whether or not we like it. It's going to be there. It's already there. It's in our phones. So making sure that the companies that we're going to entrust moving forward are, ethical, that they do have people that are involved in the conception, creation, and development of them with an ethical clinical frame of mind as they relate to mental or medical health. Um, Looking at the board of directors, do they have somebody with the expertise and the background that the company should have? If it's a health app for medical, is there a medical doctor on the board? If it's for mental health, is there a psychologist on the board? And if there's not, and it's a whole bunch of people that are engineers, it's like, well, what are they doing providing a mental health app that they don't know anything about mental health according to their background? They took a weekend workshop that doesn't quite, you know, cover thousands of hours of training and years of coursework. So just look into companies before you put your full trust in your medical or mental health into them.
That's a really great point. Thank you so much again for joining this episode. It was a fascinating conversation. I really enjoyed that. And thank you for you to staying with us. And please let us know if in the comment section if you have any thoughts, any recommendations for future topics. I'm going to ask Dr. Weissman to join us again in another conversation soon about the other topics related to AI in the therapy sessions. And we look forward to hear from you. Please subscribe to our channel and follow us to hear more. And again, thank you for joining us today.
Thank you.